Everyone, and thanks so much for joining us for our webinar on digital and data solutions in measurement, evaluation and learning, or MEL for short. We strive in all our webinars to be as practical and applied as possible, and this one's definitely not going to be an exception to that rule. Today we're going to be exploring Connected Beginnings, which is an initiative that brings together MEL, co-design, digital and data technology, and most importantly, collaborative and participatory approaches to ensure all stakeholders have access to meaningful data to measure their impact and make informed decisions. Connected Beginnings was recently the runner-up in both the innovation and collaboration categories at the Social Impact Network Australia Awards, or SIMNA, and these awards were held at the end of last year. So the timing felt right to host this webinar. But before we go any further, I'd like to acknowledge the traditional owners of the lands that I'm joining you from here in Melbourne, the Wurundjeri people of the Kulin Nation, and pay my deepest respects to their elders past, present and emerging. I'd also like to acknowledge that in Australia, sovereignty was never ceded and we're living on what is, was and always will be Aboriginal lands. My name, for those of you who've not joined a webinar before or a course with us at the Academy, is Cam Elliott, and I'm the head of the Academy at Clear Horizon. And Clear Horizon is one of Asia Pacific's largest evaluation consultancies based here in Melbourne. And we're all about taking our nerdy MEL skills and sharing them to support people to create positive impact in the world. And our Academy is all about taking those skills and sharing them in courses that are very practical and applied. We deliver courses in measurement, evaluation and learning, or MEL for short, theory of change, evaluating systems change and place-based approaches, developmental evaluation, and also data visualization and reporting. And we're going to be talking a fair bit today about that last topic. Some quick housekeeping for those of you who haven't joined a session with us before. In a moment, I'm going to kick us off with a few questions to our panelists, and I'll introduce them in a moment. And they're going to help us get familiar with Connected Beginnings as an initiative. And then we're going to move on to some questions that we've received through the registration forms that you've all provided us with over the last few weeks. And then we'll have some time at the end, probably about 10 minutes or so, we'll open up to live questions from you, our audience. If you'd like one of our panelists to answer a question, you can use the Q&A box down the bottom, which you should see at the bottom of your screen. Just type your question in there, and if it gets a lot of love through the upvote, we'll definitely address that question. So make sure you both add questions and use the upvote option. If there's a question in there that is pretty similar to one that you were intending to answer, just upvote it instead so we avoid duplication. And I encourage you to do this whenever the questions arise to you through the session. You can also use the chat function. I can see someone's dropped some chat in there already. Thanks, Dave, for introducing yourself there. So please use that as you will, just to make comments as we go. If anything's unclear, you want some clarification about something that someone said, you can do that through the chat. We are recording the session, as you would have heard at the start, and we'll be sending out a video of the session if you want to refer back to it, so don't feel like you need to take any notes. And please do share it with others if you think they'd benefit from it. So now that we've got that housekeeping out of the way, it's now my absolute pleasure to introduce our panelists for today. Joining me, we have Christine Cottrell, Chris Thongnoppakun, Ellise Barkley, and Adriana Mendieta. Thank you so much, all our panelists, for joining me today. So I might start by introducing you, Christine. Christine is the Director of Connected Beginnings Mildura, which is one of 24 sites that have been involved in the initiative. And Christine has a very long history of leadership roles in the not-for-profit sector. Thank you, Christine, so much for joining us. We've also got Chris joining us from the Tasmanian Aboriginal Centre, where he works as a policy analyst. And Chris was involved in the setup of Connected Beginnings backbone team back a few years ago and continues to contribute to the initiative. Welcome, Chris.
Thanks, Cam.
And many of you who've joined our previous webinars will probably be familiar with Ellise. Ellise is our acting director of the social impact group here at Clear Horizon, and she's the co-creator of Australia's first place-based evaluation framework. She's also one of our hugely popular mentors in the Academy. Thanks again, Ellise, for joining us. Likewise, you'll probably also recognize Adriana, who's joined us for a few webinars before and is also a mentor of the Academy. She's the digital and data consultant in our social impact group with Ellise. She's also a bit of a Power BI guru and the creator of the Power BI course called Using Data Analysis and Visualization for Social Impact. So great to have you with us, Adriana. All right, so let's dive into the questions. Ellise, I would love to hear a little bit about Connected Beginnings as an initiative, a bit of an overview, and particularly Clear Horizons' role in it as evaluators.
Thanks, Cam. Hi, everyone. Excellent to be here with you. I'm on Duckinjung country on the Central Coast and extending my respects to traditional owners and custodians from the lands that I'm calling from today. So the Department of Education, Skills and Employment and the Department of Health fund the Connected Beginnings program as a federal program, and they partner with local sites and organisations across Australia, and they're working to improve outcomes for Aboriginal and Torres Strait Islander children, for early learning and education outcomes, and also for health. And they do this around joining up of education and health services. So when the Department of Education, Skills and Employment, which I'm going to call DESI from now on, approach Clear Horizon, they approach us to update the Connected Beginnings reporting framework. And so this was with a view to improve how they did reporting at the site level with their partners, but as well to be able to tell their impact story and understand progress at an initiative level as well. So they needed to bring it up to date with Connected Beginnings, understanding, measurement and evaluation learning strategy. And that strategy sets out the types of questions they want to answer, the types of measurement points and the types of things that they need to know for their learning over a 5-year period. And so the reporting wasn't aligned with how they had developed the measurement, evaluation and learning approach. So a few years before that, Clear Horizon had helped them with leading the design and consultation around the measurement, evaluation, learning strategy. So we were well placed to be able to help bring the reporting up to date and to be in service of what they were trying to do. So in terms of, from an evaluator point of view, we're looking at a whole of initiative as well as lots of unique contexts and partnering sites. So the brief was initially to update a really basic Excel reporting template, and we did some initial scoping, and there was feedback, mixed feedback, including feedback from some of the sites, and we realised that it was an opportunity to simplify the reporting, to be able to make the data that was being collected more usable for everyone, and also to improve some of the pain points that were identified. So in particular, it was looking to reduce the data collection ask or burden on sites, and it was also an opportunity for the government to be able to have a reporting framework that could roll up what was happening locally on the ground into a whole of initiative story. So the challenge really was how to develop a social impact measurement and reporting system that catered to those unique contexts, but also could be rolled up in service of what they wanted to measure, evaluate and learn, to understand if they're on track, the difference that they were making and what difference was happening in the long term for children and families in those communities. So we went with an online digital solution, and the 5 interactive dashboards that we'll show you today are part of the final reporting system that's broader than just these dashboards, as well as these dashboards that tell a mix of numbers that are important to government as well as some of the sites. There's other narrative-based, story-based, community defined ways to be able to put evidence and different data sets in, impact stories, that sort of thing as well. So this is just one part of the broader framework, and more, wider than Connected Beginnings. This project, I think, is a demonstration of really where a lot of our energy at Clear Horizon has been going in the last few years, because more and more measurement, evaluation and learning work is going online and digital. So it's really exciting to see, you know, to be on that journey and to be able to share this as a bit of a demonstration of that as well.
Thanks, Ellise. That's really good context to have from a MEL perspective. Interested to find out more about that narrative-based evidence that you're bringing in as well later on as we go. But would love to hear from you, Chris. You were there in the early days of this initiative. You know, what was going on? What was the thinking behind it, and how did it get started?
Thanks, Cam. Yeah, I was around in 2019. I believe that's the year it was started. Just calling in, by the way, from Nipaluna, Tasmania. So in the early days, it was probably quite easy to describe Connected Beginnings because it was a very broad blanket statement. The remit was to ensure that Aboriginal children aged 0 to 5 were healthy and ready for school. But since there have been, you know, many iterations of the work, and I think it'd be best if I provide a local context because each site would differ. So, the Connected Beginnings in Tasmania is in Jordan River, and the way it works is the structure is as a governance table that sort of is comprised of various stakeholders and community members, and they drive the work, they make the decisions, they synthesize the data. And within this structure, there are various working groups that are sort of focused on, you know, community impact or education or health. And as Ellise talked to earlier, it comprises of health and education. So there's 2 components mainly, and the backbone supports this. Now in Jordan River, the work pretty much involves breaking down silos, so data sharing and whatnot, aligning the services, generating community excitement and engagement, and building these pathways. And in Jordan River, the community agency and self-determination is centre and it drives the work. Just really want to reiterate that local context is key here. The work will look different from place to place. And I think the introduction of this UML system is so important because it does allow that contextual sort of filter to come into play. Whereas the OG report, so to speak, was very cookie cutter and it wouldn't capture the good work that's happening.
It's really great, that last bit at the end there, Chris, around wanting something that's a bit more tailored or able to be adapted or adjusted to the local context. Sounds like it was really key. So I guess, Christine, speaking as one of the directors of the one of the 24 sites, what gaps or challenges did you encounter when you first started?
Yes, thanks, Cam. First of all, obviously, I'd like to acknowledge that here in Mildura, Victoria, we're on Latchi land and acknowledge the traditional owners, past, present and emerging. Yeah, well, I was a bit like Chris. I started at the Connected Beginnings in Mildura in 2018 and literally from nothing. So I turned up to my first day of work, had no desk, no chair, no computer, no nothing. So we didn't even have anywhere to sit, which is quite a shock when you're standing up for your first day of work. So we really got to start from the ground up and figure out what did we want to do with Connected Beginnings in Mildura. But to do that, you obviously need to lay groundwork and build connections and identify needs and identify goals. So that takes not only quite a long time because they're also changing throughout that period as you're doing that, but it takes significant amount of work to do that, build those connections. So our initial connections obviously with health, because we're the education side of the team, and build that. And then depending on what we decided our goals were going to be, it was how do we prioritize those? So what do we prioritize? And with regards to the data, first of all, where do you get that from? Because there's state government data, there's federal government data, and that all sits within different departments within all of those, either federal or state governments. And then there's local data, which sits with either a health site or kindergarten or various other things. So it's hard to know what to prioritize when you don't know where to go in the first place. So that was one of the first complex things that we had to work out. Where do you go? And then once you figured out where do you go, can you get the data? If you can get the data, what do you then do with it?
Thanks, Christine. It was great to hear a bit from Chris about his local context. Is there anything you'd like to share about the local context in your community?
Yeah, so we work a little bit differently, and you know, Chris is correct. Every site works very differently through Connected Beginnings, and that's been very well supported by DESI. And so, you know, our local context, we probably are a bit bigger. Mildura is quite a big sort of regional centre here, so it's not as much as, you know, the governance. If we have a governance committee or we have committees, they're also on lots of other committees here, there and everywhere, and looking at things from a sort of more of a regional area rather than a localized area. So then we have to figure out, how do we break that down? So you're looking at it from a localized area and not just an overarching regional area, which has been the trend here for, you know, what people have been doing in the past.
Thanks, Christine. Adriana, would love to see these dashboards that Ellise was talking about. I believe she mentioned there's 5 or so, and we might not have time to see all of them, or maybe we do. I'm not sure. I'll let you judge that. Oh, you're on mute. There we go.
One of these days I'll get it. Great, thanks, Cam. So I'm very excited to be showing the Connected Beginnings dashboard today from the land of the Wiradjuri. And I want to pay my respects to elders past, present, and emerging. So I am going to share my screen first. Okay, great. Can you see my screen?
Yep.
Okay, great. Thank you. So we created a suite of 5 interactive dashboards as part of this integrated digital measurement and reporting system that Ellise mentioned, to track changes at community and systems level. So we have this summative dashboard, then a community wellness at population level dashboard, one for selected community flagship indicators, another one for system and services, and one, the stepping stones dashboard. So the dashboard basically displayed data for the quantitative indicators selected to track outcomes of interest that are aligned with the Connected Beginnings mission and theory of change. So these indicators include the numbers, of course, that matter for sites and government, using a mix of publicly available data, site collected data, and health data shared by the Department of Health and site health partners. So let's see the dashboard in action. I apologize if I move my head around a little bit, as I have a couple of screens. Great. So can you see the dashboard, the Power BI dashboard?
Yep.
Great, thank you, Cam. So the first is the summative dashboard that we're looking at right now, which shows a high-level snapshot of some of the changes happening for communities, for children, across the services working together. So here we have a selection of health and learning indicators that are also shown in more detail across the other dashboards. So I would like to mention that for this demo dashboard, we're using mock data. So next we have the dictionary. This dictionary, we have dictionaries before each of the dashboard, which basically explains users what they will see on the following dashboard. For instance, they learn about the questions that the graphs aim to answer, the indicators, why this information is important that we're tracking, and the source of information. So let's have a look at the community wellbeing dashboard. So this dash tracks long-term trends for community well-being using health and education indicators that are important for sites that they have identified as important for them. So this data is compiled and shared by DESI and the Department of Health partners. So the general aim of this dash is to show changes happening happening in communities across pre-birth and life course points for Aboriginal and Torres Island children 0 to 5 years old. So this dashboard is interactive, allowing sites to explore data in different ways. For example, in this graph down here about expecting mothers receiving early antenatal care, sites can first see information about when mothers get antenatal care before 13 weeks. But when they click on this button, they can see more data points at before 13 weeks, between 13 weeks, and after 20 weeks of pregnancy. This dashboard also has more informative elements to complement the dictionary. For instance, up here we have an information button, which basically describes what this dashboard is about, and also explains the different buttons, what they do, where the filters are, and how to use them. So let us explore the other dashboard pages that we have. We have the flagship indicators dashboard page and the system services page. So for the flagship indicators page, we are showing 7 common flagship indicators selected by the sites. As Christine mentioned, at a local level, each community-led approach is unique, which means that what success looks like for community and child well-being are locally defined, needs to be locally defined. So once again, this dashboard is interactive, different buttons for sites to explore the data. Then finally, I want to jump through the stepping stones dashboard. So this dashboard shows a local progress mapping by communities across key areas or paths that we have here on the left in their collective approach and program implementation. So progress mapping is self-reported and done by sites using this stepping stones tool. It's like a rubric. And then the data collected within the community is entered to the dashboard. So this is an experimental dash in which we have tried to use the existing Power BI visualizations to reflect what is actually on the tool, and then translate it into a digital reporting dashboard. So this has been a complete adventure putting up this dashboard, and we'll be launching it this year in the coming months. So back again very quickly. Right now, you might be wondering where all this data is coming from. So basically, we have around 101 different sources. So we have 75 coming from the sites themselves, information they're collecting through our reporting system. And then we have 26 between the public websites and information shared by DESI and Department of Health. Look, this has been a great effort from the government and sites to get all this data together and up and running behind the dashboard. So how can this data be shared? So some of the data can be widely shared. Sites can share it more openly, whilst there is some data with some restrictions. So the data that sites can share widely is that coming from the publicly available sites, and the data shared by DESI that is about education. They can share with the local communities, with the community of practice, for example, similar projects. And this can be done by, for example, showing the dashboards on their own screen, sharing the screen, or exporting the data to PDF or PowerPoint presentation. However, when we're talking about the health-related data, this cannot be shared outside the project sites, the project and the sites backbone, and the own communities due to privacy agreement restrictions. So basically, when we're talking about health data, we have to manage it carefully because sites sometimes are very small, and then due to the low numbers, this data might be identifiable. So that's why it's only shareable within communities. And we also take measures. So if numbers go below, data samples go below 10, we round it up. So this will never be identifiable within communities. So when it comes to the dashboard, data from sites can only be seen by the site owner. So data sites cannot see data from the other sites. And that is basically it for me. I'll send it back to you,
Adriana.
Cam. Thank you.
Really innovative and fascinating dashboards there. I've not seen that, the bubbles and the use of that before. It's very cool.
And the stepping stones.
Yeah, I like the stepping stones too.
Indeed.
Very intuitive too, which I like. We've got a lot of questions coming through for you about the data. So I think the first one, a really important question here from Loxie Lull. I'm curious to know who owns the data.
Well, so this is a very, very important question, because our aim is that we give data ownership to sites, right? This is a community's data. This is data about community. So we strive for community data sovereignty. So as I mentioned, the public data and the information that DESI has shared, it's openly and it can be shared widely. But then when it comes to health data, well, we need to abide to the Privacy Act and to the privacy issues. So this identity so there's the limitations when it comes to this sovereignty. Is there anything else that you would like to add, Ellise?
Or Chris?
Or Chris, of course.
Christine?
Just on the data sovereignty, that's probably one of the biggest sort of, the North Star that we're doing down here at the moment. So we're working closely with the state, federal governments to really get that ownership of the data, because, it's their community, it's their story, it's their lives, it's their outcomes. But in the same, it's a tension, I suppose, because you do need to abide by certain privacy acts and ethics principles. So as far as qualitative data and sort of service data, education data, participation rates, that sort of thing, it's up to the community to determine what they want to see. And if they sort of, within Connected Beginnings anyway, if they choose a particular indicator or operationalized outcome, that's theirs. That goes into the community's collective plan, that goes into their sort of scope, essentially. But because Connected Beginnings is DESI and Department of Health, traditionally it's been quite siloed, which is, that's slowly coming together, especially with this UML, these dashboards here. But previously, health did sit very separately from DESI. We're still seeing some of that, but I think, the government's going in the right direction.
Yeah, there was a lot of behind the stage, backstage government data arrangements that needed to happen to get us this far. So yeah, it's definitely a journey where there's more progress to go, and I think that the government partners are trying to explore how they can share more data with communities that is being collected but not shared at the moment. So that's good, and that's actually one of the good outcomes of this process has been that, as sites, you've got more access to information that you didn't have previously, and there's only going to be more and more from what DESI and health are working towards. And the other aspect of it, as well as the measurement, is the learning. So this new framing of reporting also has an emphasis on how can we get the multiple partners together to surface what they're learning, because it's such adaptive sort of work and it's really complex settings. And so, as well as equally as important as the measurement on the other bits outside the dash, ways to be able to reflect and harvest learnings as well as you go.
Thank you both for that. That's cleared up, I think, It sounds like quite a messy or complex question. We could probably spend all day talking about data sovereignty, it sounds like. But one follow on there that Elliot's asked is how are you going about facilitating access to the data that is accessible for people who maybe don't have access to the internet or struggle with digital in general?
Do you mind if I talk to this one real quick?
Yeah, go for it.
So this one actually ties in nicely with Ruth's question about organizational capacity to access and analyze data. So as a precursor or preface to what we're talking about, Connect to Beginnings is, well, it has adopted a collective impact model of practice. Now, this is a complex beast in itself. Some people may know about it, some may not. But the important thing is that it's not a cookie cutter approach, and a trap would be to fall into just painting every community with the same brush. But one good thing about collective impact is there's a solid structure, a solid framework to operate within. Now, each site should have a backbone with at least one data expert or someone who's data competent. Now, that person would be responsible to synthesize this data, these meaningless numbers, the quantitative stuff, into what matters for each community. Now, in regards to the question about how would people access this data without digital means, what it may look like is a particular community may host a forum, like some sort of public forum within a community house or the gym or whatever. And that's where conversations will happen. With Connect to Beginnings, this is really aligned with Aboriginal pedagogy around just having conversations with people. So it's really up to the backbone and those stakeholders that have committed to the project to take the onus upon themselves to do this work of synthesizing the data and communicating it back in an understandable way.
Thanks, Chris. Taking it back to face-to-face, in person, to facilitate those conversations and that learning, that's great. We've got lots of questions coming through. I might move us on and return to some of them down the road. Would love, Ellise, to hear a little bit more about the process that was involved in pulling together these dashboards. I think it looks very simple and straightforward when you present the data, but I know there's a lot behind it.
Good spot. All right, so first thing to say is that the dashboards are a result of the efforts of many, many partners who are collaborating together. And so that's the government teams, the advisory group of some of the site representatives and stakeholders who were involved in the co-design, and sites who helped test and iterate the solution, and other support partners like Ninty One as well has been helping with the rollout. So it's yeah, lots of backstage and shared development by many people, and including like cross our whole organisation of Clear Horizon. We have people from different teams to be able to develop it as well. So the first step was, when we were invited in to look at the reporting framework, was to do a bit of a diagnostic step and understand what was working and what wasn't. And so we asked different stakeholders' perspectives around that. We were looking at what was being collected, the data that was being collected, being asked of sites, what it was being used for, how it lined up with serving, how they wanted to do measurement, evaluation and learning. And so through a range of methods, group and dialogue sort of sessions, we were able to identify some opportunities from that sort of 360-degree view. And so we came up with some preliminary digital solutions, and then there was lots of inputting and iteration that happened around it. And you know, then there was the digital and the data and the technical end and the comms to make it look gorgeous, to fit in with 6-month and 12-month reporting cycles. But a really big part that we have touched on was this data sourcing piece, and being able to get permissions and source what was needed to be able to feed that cohesive digital and data story that you see. And then there's been testing and trialling, and you know, there's teething problems as we roll out and we're improving, but they're definitely not a static piece. And because even though it's a technical, there's technical and digital aspects to it, but it is in this adaptive context. So it's not a set it once and forget it. This is going to need to grow and, you know, change over time, as do the sites and their ventures that they're on and what they learn and develop. So it's definitely going to grow and evolve over time. And so while it had some really awesome innovations, I reckon one of the key elements of success was watching the commitment of the collaborative partners working together, because the culture of learning and the culture around digital solutions is like totally critical for them to be able to work and go well. So anyway, that's a little snapshot of the process.
Thanks so much, Ellise. Would love now to talk about what is probably the million-dollar question on everyone's mind at this point, and what difference has all of this work made thus far? Maybe Christine, might start with you.
Yeah, thanks, Cam. So having access to data, it does make a massive difference. And it's not just having access to data, because there's lots, as Ellise and Adriana have said, there's lots of different data that is available to everybody pretty much. And I know that DESI and Clear Horizons worked really hard to get the data that the sites needed. And from a site perspective, you know, we didn't necessarily have all the conversations that Clear Horizons and DESI had together, but we were having conversations around what data do you want? What data do you need? And in the end, for the sites, it came back to the ERACI principles. So if we are having the ERACI nest principles, what data do we actually need to be able to then work out if, you know, we're working in line with those? And so I think that was the first thing, that all the sites agreed on that all together, which then could narrow the focus of, okay, well, this is the data that we actually need. And then because DESI and Clear Horizons have been able to get site-specific data, so it's not just general data for this is what's happening in the whole of Australia and try and work it out for yourself what's happening in your area. It's actually specific. You know, we can use our, you know, we have a planning session and we strategic planning and all of that kind of stuff, and we can actually input the data into our strategic planning and say, oh, well, we can see over the last 6 months, you know, data set A, B, or C has either improved or, you know, declined. So is that something that we need to put into our planning for the next 6 to 8 months to see if we can get that back up again? Or why is that? Right, okay, we can go and investigate. So it helps you set your future planning. It's not just based around, okay, well, this is the strategic plan we've put in place and this is what we've got to stick to. And I think there's also a clear understanding with DESI about, you know, as Chris said, collective impact work. It is changeable and it does fluctuate. And if you need to get halfway through something then go, oh, actually, we need to go back and change that, or, well, we said we were going to do this, but it's appearing now from community conversations and from the data and from various other things that we're going down the wrong track. We've had the freedom to be able to do that. And I think the data is imperative in telling you that the community is the most important thing that tells you what's happening in community. But if you put it together with the data, you get a better picture and you can better plan then for what you want to do going forward.
Which leads nicely onto another question that someone's asked around decision-making and sense-making. So their question here from Tonita is, what's the next step in terms of sense-making and doing that collaboratively?
I think well, doing it collaboratively is, you know, a localized thing. As Chris was saying, you know, we work collaboratively with many different organizations, and having, being able to give this data to, well, a large percentage of the data to other organizations helps you with your collaborative project planning. And because it's recognized that connected beginning sites are very difficult, even though all of the connected beginning sites have things in common. We don't necessarily all work together on the same things, but when we come together for our forums and have conversations about things, I think the data for doing that is very good as well, because it means that, you know, while we don't have access to everyone's data, we can still have conversations around what's happening, because everyone understands that people from each site have access to this data. And so it gives us that, it gives us better collaboration within all of the connected beginning sites, that if you know another site has got similar data and is having similar issues, you can pick up the phone and give them a call or Zoom or whatever we're doing nowadays to have those conversations. And, you know, sometimes you might be able to work together on improvements for that.
I'll just add as well, that from the wider reporting system that got created, behind that stepping stones dashboard is a process of coming together. So you bring people from different organisations and community into the room to reflect on how we're going with working together, with our engagement, with how we're doing our collective work and our leadership, and being able to sort of self-assess. And it doesn't need to be coming to a consensus point. There's always divergent and diverse opinions about it, but it is a shared process in how that data gets collected that does encourage some shared sense making and learnings incorporated in that fit into the bigger reporting, and then some, you know, very simple results get fed into that dashboard. But there are processes at the local level and also for the government at the initiative level that happen, learning cycles or touch points where you review what happened and what the data is looking like, including community voice, as Christine's pointed out, and then using that to inform, you know, what outcomes you achieved, what progress you're making, and the answers that you're trying to get each year to then springboard into the next round of action.
Thanks, Ellise. Chris, just to cycle back to the original question, what changes or differences have you observed as a result of this work?
I think Christine pretty much touched on everything, the key points. What I can hopefully provide here is a contrast to what's going on now and what we had to do before. So right now we have a really streamlined system. The data's, you know, collected and put in, made accessible. We can look at it, interpret it, and then pump it back out to the community. Prior to this, prior to even the 5 domains of well-being being chosen as holistic well-beings that are going to be the North Star for the project, my backbone team, 5 people, collected 1,000 voices, conducted a thematic analysis on all the voices, then operationalized these qualitative indicators into numbers. And then it was my job, one person, to go and source all this raw data from ABS, from DESI, from Department of Health, from Department of Communities. Wow. So you can imagine like how burdensome, cumbersome that is. And it's not the best utilization of manpower, especially when collective impact is about, you know, that ecological model of the child, actually doing stuff to improve outcomes rather than just crunching numbers. So I guess I'm not intimately involved with this reporting structure at the moment, but, you know, I can definitely see from my experience, like what we had to do in the past, this is a far better system,
Excellent, Chris. Thanks so much for sharing that. Sounds like it frees you or people in your role up to do much more meaningful and impactful things. So we've got a question up here about lessons learned. We'd love to hear from each of you, Christine and Chris. What are the major lessons you've learned thus far?
I think for us, it's about, you know, even though there's data and you've got access to it and you can see it and, you know, it's giving you all this information, you can do your planning around it, it's actually based on people. So even though, you know, it is data and we all view it as, well, here's the data and this is what we can do and this is how we make decisions, it's actually based on real life human beings. You know, it's like we see this COVID data every day and there's this many people in hospital and, you know, we all get so used to it and just go, oh yeah, whatever. But there's actually human beings behind it. So we always try to remember, you know, the data is actually people. So even though it informs the work that we do, the importance to bring it back to the fact that there are human beings behind it, and we need to continue to have those conversations with those human beings to see if the data is telling us the correct thing to start with, and if they, you know, agree with what it's telling us. That's been a huge, you know, learning curve, and it's a different way. We sort of maybe approach it in a different way, but it's a different way of looking at data. It's not just looking at it as numbers and statistics and how we can improve based on those things. It's okay, it's numbers and statistics, but how do we integrate that with what we're being told by the people behind those numbers and statistics?
Excellent. How about you, Chris? What
I
lessons?
could probably go on for another hour about my learnings. But in regards to data, a quote from Einstein will pretty much answer it. Not all that can be counted matters, and not all that matters can be counted. And I'm very pleased that our funders, the government, are starting to appreciate qualitative data much more. The stories behind what's actually going on in the numbers. My biggest learning would probably be in regards to data that try and look at it from a strengths-based perspective, especially with smaller cohorts, more discrete numbers. Instead of looking at the children in our area based on the early years development census are not on track, simply look at it in a way that, hey, if retrospectively, if 2 more children had have achieved such amount of outcomes, that number suddenly becomes statistically significant. Now, to a layman, that's not really that exciting, but to like the people in the data sector, that's really exciting. And then you can then transfer that excitement and generate some sort of momentum within the community to instigate high leverage actions. That's collective impact sort of language. But yeah, I think strength-based approaches to looking at data is really important in this space.
And for those who might not be familiar with strengths-based as a principle or philosophy, can you explain that a little bit?
Sure, yeah. So I'll give you the example. So if you look at the ADC data, if you see a child is not on track before they go into school, instead of reporting that back to the community in your forum or whatever mode you might do, as in just saying that we're really struggling in this area, you can just change that language to, if we help out 5 more kids in our local government area, suddenly everyone's on track, or a statistical significant proportion of these children are on track.
Right.
So just try and find the small wins, because this work is always it's not going to show a consistent correlation of positive results all the time, and it's going to take years to see meaningful change. So these small wins will keep the project going.
Fantastic, thanks, Chris. But this brings us to our last kind of formal question from me before we open up to more questions from the audience. We've spoken a heck of a lot about data, which is great. I love data. But I'm sure our audience is interested to know the practical challenges around getting to grips, getting the government and community on the same page, and then actually getting that data up into dashboards. What advice do you have for people who are currently wrestling or soon to be wrestling with that challenge? Let's start with you, Christine.
I think that's the $1 million question, isn't it? If you had the answers to that, you'd probably be very rich and be a lot wiser. Look, I think, lots of people are very sensitive around data, and rightly so, because as we've said, it's really about people, and health, especially health data is really sensitive, because it is really about people who may be unwell or may be experiencing significant health issues. So how do you go about ensuring your community that the data you have is not going to be, you're not going to do anything bad with it, and it's actually not identifiable? And as Adriana mentioned earlier, if the number is below 10, because some connected beginnings communities are very small, then they just round it up. Because, for example, if you're in a community and you have 12 kids going to kinder and 2 drop out, and so then your data's 10 kids going to kinder, and you need to find out, 6 didn't go this week, the whole community would know which kids didn't go to kinder. So it's just about understanding that it can be sensitive, but also how you use it in the right way. How do you work with the data that you've got to build the relationships that you need to get the outcomes that you want? So it's working with organizations, community in the right way, and then integrating that data into the relationships you're trying to build, and how you speak to people to then figure out the outcomes you want to get. And, as Chris said, in some communities, and mostly in all communities, if we wanted to have a percentage increase in some of the AECD data by 2%, you could be talking about as little as 5 kids. So how do you go about doing that in a collaborative manner while still keeping the integrity of those children and the community intact so that they trust you. So I think, you know, that's probably one of the biggest problems is, you know, just going through all that and working that out. And for us, it's about relationship building. And I think no matter what we've done, whether it be data or something else, if you can build those relationships and gain the trust of people, organizations, community, then whatever you approach, you know, you have a better chance of getting a positive outcome than if you just go charging headfirst and say, this is what we want to do.
Thanks, Christine. So relationships are at the center of everything you're doing, it sounds like. Chris, would love to hear your lessons in this regard.
Sure. So I think it's important to remember that we're not in a clinical case study and we're working with real people. So you're not always going to be able to, you know, imply cause and effect, and data is only going to take you so far. But in saying that, I think it's really important to have, at the bare minimum, some sort of ethical decision-making process, if not gaining ethics approval, because it is social and human research. What I mean by this is sort of steering away from health data and more sort of community-centric data. Is, you know, when you ask a community member something, if you want to sort of put your finger to the pulse, get the lay of the land. When you, let's say you're just starting up a project, you need to ask yourself, is this data already available somewhere? Because if I ask this person, are the benefits going to outweigh the risk of bringing up trauma, the risk of survey fatigue? I think this is, you know, we made that mistake in our project, you know, 1,000 voices, you know, but we had to do that. We didn't have any other mechanism at the time to enable evaluation and learning, especially for reporting. So I think now, if we were to do this differently, with this MEL dashboard in place, it would just allow more targeted approaches, allow more meaningful approaches to looking at data. But yeah, at the end of the day, the data and evaluation is only one component of the work. But you need to think big picture from the get-go. You can't just be, you know, so focused on numbers.
Thanks, Chris and Christine. We're almost out of time, but I want to make sure we fit in some questions from the audience as well. So the top question up here, we may have answered some of these as we've gone, but I'll just check. Do you have issues with the quality of data? Is it contradicting another source or maybe not aligned? And do you have any buffers to smooth this out if it does occur? That sounds like maybe a question for Adriana.
Thanks, Cam. So this is kind of part of maybe our learning from the data side. Is like, data is not going to be perfect. So this is something of the premise that we have to start with. I mean, we get some data, we try to get it as close as possible to where we need it, so it answers the questions that community needs. But then there are always going to be gaps. So yeah, we have had quite a bit of iterations, negotiations with the data sources, and try to get it up to the perfect format to be ingested to the dashboard. But there's always this much, so much that we can get. So there's a little bit of compromise there as well. So yeah, there's always, sometimes we include some caveats around the data, when it comes to comparing data from different sources. That can be quite challenging as well. So how we manage it is like, yeah, with caveats or some proxy measures as well.
Thanks, Adriana. There's another question I think is probably well suited to you as well from Rick. On the wellbeing dashboard, what do the bubbles with percentages mean where the percent is above 100%? Is that the dummy data playing out?
Yes, this is dummy data, and we wanted to make sure that it's obvious that it's dummy data. So that is why, yeah, okay. It's showing crazy numbers there. Yeah, it shouldn't be above 100%.
Can I just add something to that as well, Adriana?
Yes, sure.
For data quality, when we were doing it manually, I think that two of the most important things would be if the data is able, how can it be aggregated? How small can you get? And how consistently is it collected? ABS data is great, but it's rounded up. There are so many caveats around it. It's usually at an LGA level, so you can't drill into suburbs. So if you're going to do it yourself and you want quantitative data, keep those two things in mind. How far can it be aggregated and how often is it collected?
Great points. Thanks, Chris.
Yeah, thanks. And I would like to add something now that Chris mentioned. Actually, that reminded me is like also we try to create data tools so we can control a little bit of that data, incoming data. So yeah, giving it sites a kind of control tool to collect data, and then yeah, have conversations with the data sources as well as like, let us do it like this.
Okay, we've got another question here from an anonymous attendee. How much control is there in data collection or sourcing to ensure the data is available or reliable and can be comparable? And how is the digital process facilitated data collection? So there's a double barrel question there. Who'd like to answer that one?
I can make a start.
Sure.
So there's different types of data collection involved in this system. And so some of it at the site level is guided by questions and templates and examples of different evidence lines that would be good to put alongside the narrative reporting that they're doing. Some of the data is collected that's outside of the control of this dash system. And so it comes back to the controls that Adriana was talking about. But for the elements that we are collecting within our sort of system of it, the tools are really important. So there's also a whole set of online tools that live in SharePoint in a common space that yeah, really control and guide the data collection processes that we have. And it involves numbers, which mostly, other than I think 3, most of them are provided from government sources or wider sources, not at sites. Whereas more of the narrative reporting is collected through sites, and it aligns with a theory of change model. So we use a theory-based approach to having data across different levels of change.
Thanks, Ellise. That is unfortunately about all the time that we have together today. Probably have maybe time for one more question here from Susie, which says, how long has it taken to get this far? It seems like you've achieved a lot. Is it 2018 that this all kicked off?
This piece of work, the 2018 was Connected Beginnings program. Yeah. And Adriana, this piece of work is
started
a year
2019, October 2019. So yeah, this whole data process is been probably the longest piece of all. Yeah.
Sounds like you've navigated an awful lot of complexity and challenges in that time. So yeah, well done. Well, thank you all so much for joining me. Big thank you to you, Christine and Chris, for coming along and sharing your experience. I'm sure we all got a heck of a lot out of it, and generously giving of your time. Very much appreciated. And thank you also, Ellise and Adriana, for joining us as well. And that's all we have time for today. But I would like to also mention that we've got a couple of courses coming up that touch on a bunch of the topics that we talked about today. So jump in there and have a look at our website, clearhorizonacademy.com. And if anything intrigues you, get in touch with me, and I'd be happy to talk about the courses and how we might be able to support you to apply some of the stuff you've learned here today. Thanks again, everyone, and see you at the next webinar, hopefully. All the best.
Thank you.